much. Can you all right? First of all, thank you very much for having me here. So I want to talk to you about generative AI. Very recently, the executive team of IndiGene had an opportunity to look at some of the use cases of what generative AI can do for all of us. The first reaction that at least I had when I saw the use cases was, this is magic. Never thought about how things could be so productive so fast. The improvement, I could not imagine. And as we were reflecting on why is it that we are not able to fit any of these innovations in the right construct, what dawned on us was that these molds don't exist for us today. The thinking molds, the thinking constructs that we have used over the last 40, 50, 100 years, generative AI does not fit into those molds. So today the biggest need or the biggest reason that you guys should be thinking about, the direction you should be thinking about, is how do you in your organization reevaluate the modes that you use to think about new technology. One thing I'm reasonably sure and was very clear to all of us is that after internet, generative AI is going to be the next big thing that's going to reshape the way we do it. The question is not that do we need to change. The question is what is the velocity of change? Are we going to, in our organization, look at generative AI as an enabler and be at the front end of it? Or are we going to adopt the change once it is forced to us? So that is extremely clear to us. And I go back to a couple of examples. I remember reading somewhere in 1970s, keyhole surgery was innovated and a lot of healthcare practitioners resisted. And today I think it's probably one of the things that's a go-to thought process when you think about surgeries. Generative AI is in that space. It's in the space of how internet changed our world. We speak about internet era, mobile era. Without internet, none of these would have been possible. It's difficult to imagine today how generative AI is going to change a lot of these functions. And the reason obviously is because we have released this technology into the wild a few months ago. So there are no real experts of generative AI. Some people know a little bit less, some people know a little bit more. But again, there is one concurrence that this is going to change the way we do business, the way we innovate, the way we go to customers and so on. So think of a few use cases, like what can generative AI do? I mean, I heard a lot of thoughts from Anil, from Mr. Pant also on innovation. The way generative AI can impact drug discovery has a very far-reaching impact. To discover the molecules, to look at the clinical data and look at drug interactions. If all of that can be done through generative AI, you would end up saving 90% of money and time to develop drugs. Now, I'll talk to you a little bit more later in the presentation also about how India can be at the forefront of it. What can our demographic dividend get to us which some of the other companies or other countries cannot do? Again, we did some work and figured out what are the areas that are ripe for immediate disruption. What are the areas that take some little bit more time? So if you look at this chart, everything you see on the bottom right in red, in our opinion, if you have already not started thinking about it, if you've already not disrupted that in your organization, you're late to the table. The one in the middle section are the areas where use cases are already developed, people are already implementing them, they may not be at scale. And the velocity of change is so high, maybe next time I speak to you in 6 months, all of this will be in there. And now people are talking about which are the areas which are traditionally been very human innovation driven that can now look at a disruption. So again, I keep going back to this whole idea of velocity of change because that's what we are dealing with today. And this is one technology where we feel a higher velocity of change than anything we have seen in the past is what we're going to be building. So just to give you a full idea on what can be changed, and I spoke to you about research and innovation, how structuring of molecules has been done by generative AI. A lot of the work that is done on clinical data and processing of clinical data to look at interactions done by generative AI. I'll give you one example, and this literally blew me apart. We looked at an email that was sent to an HCP by one of the brands in a pharma company. That email was changed into a live video using deepfake in 3 minutes. Traditionally, this kind of work through agencies, through companies like Indigene takes a few weeks, right? Because you're trying to figure out what the script should be, what the actor should be, what the scenario should be, and then you ultimately go develop the video. By using LLM technologies today, this can be done in 3 weeks. So that is the impact that we're going to see on how, from the value chain standpoint, the drugs are discovered and how messages are passed on to the consumer. That's the level of change that we see in the future. Again, and if I think about people in the room, all of you guys, I think number one responsibility that you all share is how do you take the message to your customer. So this technology is going to help you not just innovate in terms of how and where you see your clients, how and where you see your target audience, but also how you analyze the data. And all of the integrated data systems are going to mean that you're going to take this data, feed it back to your oracle systems, and make your processes much more efficient than they are today. And I have no doubt in my head that all of these collaborative efforts that we see across the globe on developing generative AI and AI in general are going to lead to change the way we do work. So, what does this mean for India as a country? And this was again a lot of data that was shared with us. India is probably way ahead compared to GenAI adoption compared to many other countries. If you look at the stat on the top right, 57% is what the adoption rate is for Indian companies compared to a much lower rate in the US and Europe. Also, what is interesting is that most of the use cases that we see in generative AI today in India are horizontal in nature, which means that applicability of those cases to healthcare is again going to be very, very high. So the thought process of how we can take a lot of these processes, release a lot of our resources that we implement today or that we take today, and repurpose them towards generative AI is not going to help just you in your organization here in India, but it can also set benchmarks for a global organization. A lot of the so think of it like when Captive came 25, 30 years ago. I think Genpact, I remember, was the first captive that started in finance and moved on and so on and so forth. Now is the time for using some of these technologies and looking at innovation in unlimited. The amount of demographic dividend that we have and the number of people that we release from lower end jobs and that population which has the base skill set that can really be used to do those innovations, to create those innovations, and thereby, it doesn't just help India, it helps everybody in the world to reduce time to innovation, to reduce cost to market, and so on and so forth. And all of this then feeds in to augmenting and strengthening the pharma functions, right? And then that enables to lead better healthcare. We saw the initiation of AI in the medical technology side of the world. They said that image recognition can really change, can really help diagnose, and that was preceding to what pharma focuses on, actually the curative powers of pharma. And those systems can now be generated towards or can be targeted towards the pharma companies to make sure that we are able to capitalize this industry and move forward. And India doesn't need to be the hub for generic. It doesn't need to be hub only for value. I think it's time that we go ahead and make India use these technologies and make India the hub for innovation. Thank you very much.